breast cancer. It's a phrase that evokes a lot of emotions, fear, uncertainty, maybe even a sense of helplessness. But knowledge is power. Understanding this disease is the first step in fighting back. Breast cancer develops in the cells of the breast. It can occur in both men and women, but is more common in women. We'll discuss types, risk factors, and treatments. Early detection is crucial. Consult your healthcare provider for any concerns. Let's start by talking about ductal carcinoma in situ, or DCIS. This is considered a pre-cancerous condition or stage 0 breast cancer. Abnormal cells are found in the lining of the milk duct but haven't spread outside the duct wall. While DCIS isn't life-threatening, it increases the risk of invasive breast cancer. Early detection is crucial. The good news is that DCIS is highly treatable. Treatment typically involves surgery and sometimes radiation therapy. Moving on to invasive ductal carcinoma, or IDC. This is the most common type of breast cancer, accounting for about 80% of all cases. In IDC, cancer cells break through the milk duct wall and invade surrounding tissue. This means the cancer can spread to lymph nodes and other body parts. Early detection and prompt treatment are critical. Effective treatments include surgery, radiation, chemotherapy, hormone, and targeted therapies. Now let's talk about invasive lobular carcinoma, or ILC. This type of breast cancer begins in the lobules of the breast, which are the glands that produce milk. ILC is different from IDC in how it spreads. While IDC tends to grow in a more defined mass, ILC often grows in a single file line, making it harder to detect on a mammogram. This type of breast cancer can be more challenging to diagnose, as it may not always form a lump that's easily felt during a breast self-exam. However, like IDC, ILC can be effectively treated with surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapies. Regular mammograms and breast awareness are crucial for early detection. Now, this next type of breast cancer we need to discuss is particularly aggressive and requires a specialized approach to treatment. It's called triple-negative breast cancer. This type of cancer tests negative for 3 key receptors: estrogen receptors, progesterone receptors, and HER2 receptors. These receptors are like doorways on cancer cells that certain therapies can target. Without these receptors, common treatments like hormone therapy and HER2-targeted therapies are ineffective. Triple-negative breast cancer tends to grow and spread more quickly than other types of breast cancer. It's often diagnosed at a later stage and has a higher risk of recurrence. However, there is hope. While treatment options may be more limited, chemotherapy remains a cornerstone of treatment, and researchers are making strides in developing new therapies specifically for this subtype. Finally, let's talk about HER2-positive breast cancer. This type is characterized by a higher than normal level of the HER2 protein on the surface of the cancer cells. This protein acts like an accelerator, driving the growth and spread of the cancer. The good news is that we have specific therapies that target the HR2 protein, effectively shutting down this growth signal. These HER2-targeted therapies have revolutionized the treatment of HER2-positive breast cancer, significantly improving outcomes for patients. In addition to HER2-targeted therapies, treatment for HER2-positive breast cancer often involves a combination of surgery, chemotherapy, and sometimes radiation therapy. The specific treatment plan is tailored to each patient, taking into account the stage of the cancer, the patient's overall health, and other individual factors. We've covered a lot of ground today, and I hope you found this information helpful. Understanding the different types of breast cancer, the risk factors, and the treatment options available is empowering. Early detection and advances in treatment have significantly improved the prognosis for many patients. Stay informed and take proactive steps for your health. This includes regular self-exams, knowing your family history, and scheduling routine mammograms as recommended by your healthcare provider. Remember, you are your own best advocate. By staying informed and proactive, you can take charge of your breast health and make informed decisions.